Hey, my name is Jeb. I'm from Jacksonville, Florida. In America, I go to college at Amherst College in Amherst, Massachusetts. I'm a student working with Fadas Travel, encouraging American tourism to Turkey. I'm currently at Mox Cave House in Cappadocia, Turkey, which is owned by Fadas Travel. It's an incredible hotel. I've eaten breakfast here. I've laid out on the roof a lot. There's a beautiful arrangement upstairs for you to tan or just read a book. It's really peaceful. You can hear the birds. It's absolutely wonderful. I'm filming a set of videos encouraging Americans to travel to Turkey and alleviating some concerns that you might have surrounding the Middle East or Islam or health tourism and why is it cheaper. In this specific video, I met with Argan, who is a manager of a hospital in Turkey, Uzdin. They're throughout Turkey, and it was absolutely fascinating, and I'd like to share what he told me with you guys. I discussed with him, he's the sales and public relations manager of the hospital. This hospital does dental procedures, mouth surgeries, jaw surgeries. They create technology to use in the dental field, all sorts of things. I'm gonna be kind of talking about something which is a complete disaster in America, which is our healthcare system. Uzdin is a private hospital, which is completely different than American systems, and I'm going to kind of talk about how our healthcare system is completely different than theirs, but how we can use the system for our advantage. In the past, all of Turkey's healthcare sectors were different, but now they've all become socialized. So obviously, because we live in America, there is a stigma surrounding socialized healthcare, and people are kind of worried, is it not as good? Am I going to have to wait to get it done? There are all these concerns about it. Funny enough, I'm very into politics, and one of the biggest actually political issues is funding towards socialized healthcare. The number one expense for Turkey is the military, and the number two spending is healthcare. So those are the 1 and 2. So the question might be is, why is it so expensive in America? Why is American healthcare so much more expensive than Turkish? Well, one of the biggest reasons is our ambulance chasing insurance culture that we have created. In America, we have a culture where lawyers are looking to sue for practically anything. So hospitals actually have to stockpile money. They have to charge more for these procedures to stockpile money just in case for when they have to dish it out for lawsuits. Turkey does not have, or anywhere really in the world, does not have this extremely volatile legal climate. So there are two main reasons why doctors and hospitals get paid so much more in America. Number one is the government is in control of it in Turkey, so there's not an incentive to upcharge all of its residents for more money. There's less of a capitalism involved and there's more of a socialized reason. Also, it's the higher demand of doctors in the US. One of the biggest reasons is med school is so long and so expensive. In Turkey, it only takes about 5 years, 4 years for an undergrad, and then a year for linguistic training if you're coming from another nation to become a dentist. In the US, it's 8 years. To become a doctor in Turkey, it's about 6 years, where in America, it's 11 to 15 years after residency. So because of this, a lot of Americans are less willing to go through the long and expensive schooling required to become a doctor to make the high money. So there are less doctors in the US. So complete random numbers, if there's one doctor for every 100 people in the US, there's one for every 20 in Turkey. And for that reason, since there's less of a demand, it is much cheaper in Turkey. Now, this doesn't necessarily mean as soon as Turkish doctors graduate, they're just thrown into the medical scene to do brain surgery on whoever. There is a level of expertise required to go up to the higher surgeries. So you might be getting shadowed as soon as you graduate or whatnot. But the point is that Turkish doctors are usually getting even more experience and more repetitions than American doctors, because American doctors are usually in school for much longer, learning from a textbook. With Turkish doctors, there is more practice involved. Another reason why the medical field is so much more expensive in the US is just the profit margins. It's our extreme system of capitalism. In Turkey, a bottle of Advil is about 20 cents for Turkish residents. In the US, it can be charged as much as $20 in a pharmacy or $60 in a hospital. In the US, we have a culture where it's societally expected to charge as much for a product as people are willing to pay, including necessary medical procedures. In Turkey, they don't believe that. There are religious reasons and there are cultural reasons, but pretty much the underlying point is they don't have as rigid of a capitalistic society that they believe it's right to charge as much for a product as possible, and the government steps in and charges what they think is fair. Their entire nation has access to healthcare. Even in the US, I didn't know this, roughly 8 to 10% of our own citizens are expected to not have any form of medical health care. This means 35 million people are living in the richest country of all time with zero health care. That's insane. In Turkey, every single citizen, even the poor, even the refugees, have access to healthcare. Now I know what you guys are thinking. If it's so much cheaper and about the same quality, why aren't people doing it? And mostly the reason is people either have never even considered it or didn't even know it was an option. Very few people would consider going to another nation to get healthcare done. One of the ones that people do go to from America is Mexico. Obviously, it's a lot cheaper, but Mexico has gotten so dangerous recently, and it's kind of been dangerous for the last 40 years. And Turkey would be a much safer nation to travel to than Mexico and have the risk of getting killed. Recently, the Turkish government actually passed a law that all US citizens who are receiving health tourism or health care in Turkey have insurance. So you shouldn't be worried about whether your insurance will cover if you have a medical malpractice while you're here. So if for whatever reason, in the unlikely scenario that something does happen to go wrong, the Turkish government will actually fly you back out, cover it completely, pay for your procedure, and get it redone to make sure you get the procedure done that you expected to. The reason that people don't do this is Americans automatically assume that cheaper means less good or less quality. There are 1,000 marketing or psychological reports on this, and it's just simply not true. Do not confuse the insanity of America's dysfunctional healthcare system with the global norm. America's healthcare system is laughed at across the world, and you shouldn't hold another country accountable because America has not really figured it out and it's absurdly expensive. Turkey uses our research and technology, but they don't have this hybrid mix of toxic suing culture and rigid capitalism and a dysfunctional Congress that makes fixing our healthcare system even virtually possible. Turkey has world-class doctors and top-notch facilities. It would make your American dollar go exponentially further in Turkey than it would in the US. I love America. I love Turkey. I could not recommend traveling to Turkey enough and getting health tourism done in Turkey.